Most people don't think about their kidneys until something goes wrong. And by the time something feels wrong, the damage has often been building quietly for years. I'm Dr. Eleanor Hayes, an internal medicine physician, and in over 20 years of clinical practice, I've seen this pattern more times than I can count. A patient comes in for a routine checkup. They feel fine, and then the lab results tell a completely different story. Here's what I want you to understand today. Your kidneys are filtering about half a cup of blood every single every minute of every day. They remove waste, balance fluids, regulate blood pressure, and help your bones stay strong. They do all of this silently, without a single symptom, until they can't keep up anymore. And after 60, kidney function naturally begins to decline. That's not a scare tactic, that's just biology. But here's the empowering part. The earlier you recognize the signs, the more you can do about it. Today I'm going to walk you through 3 signs that your kidneys may be under serious stress. These aren't dramatic symptoms, they're quiet ones, the kind that are easy to dismiss, easy to explain away, and easy to miss entirely. I want to introduce one idea that will connect everything in this video. I call it the silent threshold. Your kidneys have remarkable reserve capacity. They can lose a significant amount of function, sometimes up to 40%, before most people feel anything noticeable at all. That's the silent threshold. You can be well past it before a single alarm goes off in your body. That's why these 3 signs matter so much. They're the body's quiet way of signaling that the threshold is being approached. Let's go through them one by one. Sign 1. Persistent puffiness around the eyes and ankles, especially in the morning. Most people blame this on a poor night's sleep, too much salt the night before, or just getting older. And sometimes that's true. But there's a specific kind of swelling that tells a completely different story, and most people don't know the difference. Here's the science behind it. One of the kidney's most important jobs is to filter a protein called albumin and keep it inside the bloodstream where it belongs. When kidneys are under stress and their filtering system becomes damaged, albumin can begin to leak into the urine. As albumin levels in the blood drop, the blood loses some of its ability to hold fluid in place. That fluid shifts outward, into the tissues around the eyes, the ankles, and the feet. The medical term for this is edema. And when it's connected to kidney stress, it tends to show up in a specific way. It's often worst in the morning, particularly around the eyes. It may press in and leave a small dent when you push on it with a finger, and it doesn't fully resolve with rest or elevation the way ordinary tiredness-related puffiness does. In my practice, I've had patients tell me they thought their face looked puffy for months and assumed it was allergies or poor sleep. They never connected it to their kidneys, and that's exactly the silent threshold at work. The body sending a message that's easy to misread. Now, swelling alone doesn't confirm a kidney problem. Lots of things cause swelling: heart issues, medication side effects, venous insufficiency. That's why the next step matters. There's a simple urine test your doctor can order called a urine albumin to creatinine ratio. It checks whether protein is spilling into your urine. If it is, that's a meaningful signal worth following up on. The real-life takeaway here is this: if you notice persistent puffiness, especially around the eyes in the morning, or swelling in the ankles that returns day after day without a clear reason, don't just wait it out. That's the kind of quiet sign worth mentioning to your doctor. Sign 2. A specific kind of fatigue that sleep doesn't fix. Stay with me here, because this one surprises most of my patients when I explain the connection. Fatigue is one of the most common complaints I hear from patients over 60, and most people assume it's just part of aging. Less energy, slower mornings, needing more rest. That assumption is understandable, but there is a distinct quality to kidney-related fatigue that sets it apart, and learning to recognize it can make a real difference. Here's what's happening underneath. When kidney function declines, waste products that should be filtered out of the blood begin to accumulate instead. One of these is a compound called urea. As urea and other waste products build up in the bloodstream, a state doctors refer to as uremia, they affect nearly every system in the body, including the brain and muscles. At the same time, kidneys play a critical role in producing a hormone called erythropoietin. That hormone signals the bone marrow to produce red blood cells. When kidney function falls, erythropoietin production drops, and so does the red blood cell count. Fewer red blood cells means less oxygen being delivered to the muscles and brain. The result is a heavy, persistent fatigue that feels different from ordinary tiredness. The distinguishing feature is this: ordinary fatigue gets better with rest, a good night's sleep, or a lighter schedule. Kidney-related fatigue doesn't. It's often described as a heaviness, a feeling of being drained even after doing very little. Some people describe waking up after a full night of sleep and feeling like they never rested at all. Brain fog, difficulty concentrating, and a general lack of motivation often accompany it. Think of someone in their mid-60s who is active and sharp and gradually starts feeling like they're running on empty, not dramatically but slowly, steadily. They adjust their schedule, they drink more coffee, they assume it's stress or age. Meanwhile, a simple blood test, a complete blood count, and a kidney function panel might have revealed the real picture much earlier. The question I encourage people to ask themselves is this: is my tiredness responding to rest, or does it keep returning no matter what I do? That distinction is worth paying attention to and worth bringing up with your doctor. Sign 3. Changes in urination that most people are too embarrassed to mention. Here's what most doctors don't have time to explain in a routine visit. The kidneys produce urine, so it makes complete sense that when the kidneys are under stress, the urine itself often changes first. But because conversations about urination feel uncomfortable or unimportant, most people never bring these changes up. And most of the time, doctors don't ask unless prompted. Let me tell you what to look for, clearly and simply. The first change is foamy or bubbly urine. Occasional bubbles in the toilet are normal, especially with a fast stream. But persistently foamy urine, foam that lingers, that looks more like soap suds than a few passing bubbles, can be a sign that protein is spilling into the urine. This goes back to what we discussed with albumin. Protein in the urine creates surface tension that makes it foam. It's not painful, it's not dramatic, but research suggests it's a meaningful early signal of kidney stress that far too many people ignore. The second change is urinating more frequently at night. Most healthy adults don't need to wake up more than once to use the bathroom. When the kidneys lose their ability to concentrate urine efficiently, they may begin producing larger volumes of dilute urine, which means more trips to the bathroom, particularly after midnight. People often blame this on drinking too much fluid in the evening, an aging bladder, or prostate issues in men. And sometimes those are the right explanations. But frequent nighttime urination is also a recognized early sign of declining kidney function, and it deserves to be evaluated rather than just accepted. The third change is a shift in urine color toward consistently very dark or consistently very pale. Very dark urine can indicate dehydration, or in some cases that the kidneys are struggling to dilute waste effectively. Consistently pale, almost colorless urine throughout the day, even when fluid intake is normal, can suggest the kidneys are losing their concentrating ability. Neither of these is definitive on its own, but paired with other signs, they add to the picture. Here's the empowering truth about all three of these urination changes. They're observable. You don't need a test to notice them. You just need to know what you're looking for. Now here is the surprising insight I saved for last. Research suggests that one of the most common causes of gradual, undetected kidney stress in people over 60 is long-term use of over-the-counter pain relievers, particularly non-steroidal anti-inflammatory drugs, the kind most people know as ibuprofen or naproxen. These medications are used daily by millions of people for joint pain, back pain, and headaches. They're considered safe because they're available without a prescription, but studies suggest that regular long-term use, especially in people over 60 who may already have some degree of reduced kidney function, can quietly accelerate kidney stress over time. I'm not telling you to stop any medication you're currently taking. That is a conversation for your personal physician. But I am saying, if you use over-the-counter pain relievers regularly, it is worth bringing up at your next appointment. Ask whether your kidneys are being monitored. Ask whether there are alternatives worth considering. That one conversation could matter more than you realize. Here are 3 smart questions to bring to your next doctor's visit. Can we check my kidney function with a blood and urine test at my next appointment? Given my age and health history, how often should my kidneys be monitored? Are any of the medications or supplements I take regularly known to affect kidney function? These questions take less than 2 minutes to ask. The answers could shape the next decade of your health. Let me leave you with this. Your kidneys have been working for you every single minute of every single day for your entire life. They don't ask for much attention. They don't complain loudly. But after 60, they deserve a little more of yours. None of what I shared today is meant to alarm you. It's meant to equip you. Puffiness that doesn't go away, fatigue that sleep doesn't fix, changes in urination you've been brushing off. These are quiet signals, and quiet signals caught early are exactly the kind that give you options. If this video helped you, please subscribe. Every week I share research-backed health insights you won't find in a 10-minute doctor's visit. This video is for educational purposes only and does not replace advice from your personal physician.